Hello, my name is Sarah Thompson, and I'm a third-year pharmacy student at the Ben & Fish College of Pharmacy at UT Tyler, and today I'll be going over hydroxychloroquine with you. Hydroxychloroquine is also known as Planquenil, and it comes as an oral tablet. Hydroxychloroquine can be used for a few different things. One of those is to treat or prevent malaria, and it can also be used to treat certain autoimmune disorders such as lupus or rheumatoid arthritis. When taking this medication, you want to take it with food or milk. You want to swallow it whole, but do not crush, chew, or break it. You want to keep taking this medication even if you feel fine, and do not take antacids or Kaolin within 4 hours of taking this drug. If you are taking hydroxychloroquine for prevention for malaria, you want to talk to your doctor on when to start taking this drug. It may be about a week or two before you travel to an area where malaria is common. If you happen to miss a dose, take the missed dose as soon as you think about it. If it's close to the time for your next dose, skip the missed dose and go back to your normal time, and never ever take 2 doses at the same time or extra doses. So this looks a little overwhelming. These are some side effects that you should be aware of. I put the red box around these because these are some that if they occur, you want to call your doctor right away. So some of the side effects that you should be aware of are signs of an allergic reaction. So like hives or a rash or trouble breathing, feeling like your throat's closing up, stuff like that. Signs of liver problems, so like yellowing of the skin or like really dark urine. Signs of low blood sugar, so maybe you feel like you're really tired or start feeling sweaty. You may have seizures, new or worse behavior or mood changes like depression or thoughts of suicide. You may have bad dreams, hearing changes, change in balance, trouble controlling your body movements or your eyes. You may feel shaky or have muscle weakness or swollen glands. You may have a fast or abnormal heartbeat, very bad dizziness or passing out, shortness of breath, considerable weight gain, or even like swelling in the lower legs. This can all be a sign of heart failure. And you may have a severe skin reaction. This can happen at any time during therapy. And if you're taking the preventative hydroxychloroquine for malaria, you may notice a fever that occurs while in or after returning from a place with high instances of malaria. So if you do notice this or any of the other ones, go ahead and give your doctor a call right away. Some other side effects that you should be aware of are feeling dizzy, tired, or weak, having a headache, feeling nervous or excitable, not feeling hungry, weight loss, upset stomach or vomiting, stomach pain or diarrhea, changes in skin or hair color, and hair loss. These may be bothersome, and if they are too much or they affect your day-to-day life, go ahead and give your doctor a call. Some things that you should tell your doctor before starting hydroxychloroquine are if you're allergic to this drug or any part of it, if you have a history of long QT or abnormal heartbeats, if you have low magnesium, potassium, or slow heartbeat, if you have any eye problems like retinopathy, if you have heart failure, weak heart, or you have had a heart attack, if you have porphyria or psoriasis, if you're taking cimetidine or rifampicin, if you're taking any other drugs that may prolong the QT interval. It's very important to inform your doctor and pharmacist about all health issues that you may have and all the medications that you're taking, so that includes prescription, over-the-counter, natural products, and vitamins. So when storing hydroxychloroquine, you want to keep it in a dry area at room temperature away from children and pets. And you do not want to store it in the bathroom, and you do not want to flush it down the toilet or pour it down the drain. Okay, so to recap, I have a few questions for you. So question number 1 is, which of the following is something you would want to monitor during hydroxychloroquine therapy? Is it A, weight, B, eye changes, C, signs of liver damage, D, muscle changes, E, mood changes, or F, all of the above? I'll give you a second. All right, and the correct answer is all of the above. Yeah, that's great. So definitely all of these are things that you want to watch out for. So what it's recommended while taking hydroxychloroquine to monitor your weight. So maybe taking your weight every day or every other day so that you can catch any, substantial weight gain. Eye changes, any signs of liver damage. So, keep an eye out on the color of your urine or if the color of your skin starts to yellow. Any muscle changes, if you feel fatigued or if your muscles just feel weak, and mood changes, so like signs of depression or anything like that. All right, which of the following side effects should you call your doctor about right away? Is it A, vomiting, B, considerable weight gain, C, not feeling hungry, or D, headache? I'll give you a second. All right, and the answer is B. Great job. So yeah, it is considerable weight gain. That is a sign of heart failure, and you may also know that you have some swelling in the lower legs. So if you do notice this, you want to call your doctor right away. All right, last question. Which of the following would you inform your doctor about before taking hydroxychloroquine? Is it A, if you have psoriasis or porphyria? B, if you have eye problems? C, if you're on a medication that prolongs QT interval? D, if you have existing heart issues? Or E, all of the above? Okay. The correct answer is E, all of the above. Great job. Yeah, so these are all things that you want to tell your doctor about before you start hydroxychloroquine therapy. Okay, well, I hope that was helpful. If you do have any other questions, there's a link below this video that links to the patient education pamphlet. If that doesn't answer any of your questions, do not hesitate to reach out to your doctor or pharmacist for any other questions or concerns. I've also provided a link below that has drugs that prolong QT interval if you are curious and you do not know. And I hope this was helpful. Thank you so much.